We are a group of undergraduate students at Miami University researching kidney disease in Uddanam, India, located in the west coast of the country. We chose to target chronic kidney disease as an epidemic affecting multiple rural communities in India. Now to introduce you to our team.
I'm Adia Johnson,
I'm Liam Felice.
I'm Mary Gabriel.
and here is our agenda for today. Starting, we will cover the pressing issue in Uddanam, India. Next, we will look at our introduction, our background, our intervention, our three project aims, an overview of our budget, and a breakdown of our budget. Lastly, going into the significance and impacts for our proposed project of a 5 year plan. Starting with our key statistics, we found that over 90% of patients requiring dialysis treatment or transplants cannot afford healthcare costs, while 65% of those patients lack insurance coverage. Financial insecurity following delayed treatment increases mortality rate significantly. Next, we want to go into an introduction. There are currently 850 million people being affected by chronic kidney disease worldwide, with 185 million of those individuals living with CKD. We chose to target the city of Udandam, located on the west coast of the country, due to this issue. They currently have a poor infrastructure and a poor healthcare system. We want to target individuals directly who are high risk, those being 45-year-olds and 64-year-olds, which are oftentimes living with hypertension or diabetes already. These are typically individuals who are current or previous smokers using heavy alcohol or people living with, again, diabetes and hypertension.
As we dive into the background of chronic kidney disease, or CKD, it's crucial to understand just how important this issue is. Approximately 10% of the world's population is affected by CKD. This means that millions are living with a gradual loss of kidney function. With Uddanam having a population of 5.5 million civilians, there will be thousands of cases of chronic kidney disease a year. Without early detection, people can be living with the chronic kidney disease, often without realizing it until it's too late. Currently, there are no cures for chronic kidney disease. We can only provide treatments to help prolong a patient's life. This highlights the critical need for early detection and intervention. Moving on to our intervention, we are proposing mobile clinics that will not only provide free screening, but also access to dialysis. Making clinics mobile will be crucial for reducing mortality rates and enhancing early detection of chronic kidney disease, which can be life saving. These clinics will conduct quick urine tests and have trained staff for screenings, ensuring that high risk patients receive the follow up care they need. We will want to meet with community leaders, local media to discuss educational materials to raise awareness and encourage participation from residents. The data we gather from these screenings will be securely collected and analyzed. This information will be vital for advocating health policy changes that can further support our goals. Finally, our 5 year monitoring and funding plan is designed to secure the project's long term impact and potential expansion to other rural regions, emphasizing the sustainability in our approach.
Okay, so our first aim in this project is to address the lack of access to diagnosis among the people of Uddanam through a mobile clinic providing free access to screening for chronic kidney disease. So across India in rural places such as Uddanam, there's a very limited access to any kind of health centers, and someone who's in need of dialysis or screenings may need to travel long distances in order to receive the care that they need. This oftentimes results in that individual missing work or missing school. So our mobile pop-up clinics will help to combat this issue, reaching individuals who are the most at risk and yet, as of now, the least likely to receive care. The pilot study allows us to implement early screenings for chronic kidney disease, diabetes, and hypertension, which are three of the most devastating diseases in the region. Catching these diseases in the early stages is absolutely crucial, and by enabling earlier intervention, we will reduce mortality rates in the region of Uddanam.
So next for our second aim, we will offer the first round of free dialysis treatment for patients who test positive to CKD. Providing access to adequate dialysis treatment will significantly improve the quality of life for patients. Although it is not a cure, like Mary said, chronic kidney disease, it will help manage those symptoms, and allow individuals with kidney failure to live longer and maintain their lifestyle. Dialysis treatment is a necessary step while waiting for a kidney transplant, and it is essential for the longevity of the patient. In turn, we will reduce mortality rates in the area.
For our third and final aim, we will focus on patient referrals. After a patient's first dialysis, they will continue to need treatment. Many patients need dialysis once or twice a month. We will have our on site nurses refer patients based on their location and their ability to travel. Not only do we want to help refer patients to their next treatment facility, our team also wants to find financial programs that will help cover costs of dialysis treatment for these patients.
Okay, so here is the budget breakdown. So, in order to fund our intervention, we are seeking a 5-year R01 grant funded by the National Institutes of Health, which funds research projects focused on health related issues. It's one of the most common and prestigious sources of funding for independent researchers in the US. R01 grants typically support a specific project for 3 to 5 years and provide funding for staff, equipment, and other research needs. So now looking at our direct costs, equipment comes at our biggest expense, which includes a hemoglobin setup as well as our medical truck and dialysis machine. Our senior personnel comes in at around $45,000, with other personnel coming in at around $76,000. Our consultants also make up a big amount of our total direct costs, which include crucial components to our project, such as the doctor, nurse, medical driver, project manager, and psychologist. Last but not least, travel and other direct costs account for a very small portion of the total direct costs. Now we'll take a look more specifically at the individual costs on the next slide. So, budget for year one. So, after looking at the total direct costs of our project, we'll now focus on just the budget for year one. So, the total direct costs in year one amount to $129,905, which is the highest cost for any of the 5 years, largely due to the equipment, which makes up half the budget. The equipment includes a one time purchase of our medical van, as well as our dialysis machine, and then yearly purchases of materials needed for hemoglobin. The consultants, all of whom will be found locally in India, together will receive $31,404 annually. Other personnel accounts for 16% of the budget, and that includes our student salaries for the three of us working on this project. So Adia is the data analyst, Liam, myself, is in charge of the marketing, and Mary is the project evaluator. And senior personnel includes Dr. Hay, the project investigator, who makes up 5% of the budget. Then we have travel expenses, which will be allocated for the complete round trips of our stakeholders who are traveling from Miami University, for example, Dr. Rollins. And this accounts for any traveling, such as flights as well as hotel costs. And last but not least, our other direct costs include materials that we need inside of the van, a one time purchase of two computers, a tablet, and a printer, along with an annual subscription to the Epic EMR system, which will support the management of various healthcare functions. So after looking at the budget, I'll pass it off to Adia to talk about the significance.
Thanks so much. So, looking at our significance and impacts, we know that our goal is to not only detect more cases, but to reduce mortality rates by enabling early intervention, connecting patients to care long term, and preventing progression of the life threatening illness. We not only want to provide these impacts, but this clinic will become a discovery for hub a discovery for awareness and innovation. We aim to significantly impact the environment in this area by improving the mortality, by providing access to the barriers. We will then provide free screening for up to 5 years. We will bring health equity to all individuals in the community by empowering marginalized people to improve their health by getting screening, and we will improve the quality of life overall in coping strategies for the people living in rural India. Providing health equity in healthcare is essential part of life for everyone, and in our aim, we will do this by as follows with our 5 year plan. Thank you so much.
Thank you.
Thank you.